Hi, my name is Chien. I'm a medical breast oncologist at UCSF. I was honored to be able to chair and speak at the Bernard Fisher Clinical Science Symposium at ASCO 2025 this year. This session highlighted 4 abstracts around ctDNA in breast cancer, spanning both the neoadjuvant, adjuvant, and metastatic setting. We are seeing numerous trials and studies reporting on potential clinical applications using ctDNA in breast cancer. My talk really started with sort of foundational. What is ctDNA? ctDNA is the fraction of cell-free DNA that is shed by tumor cells, and ctDNA makes up only about 1% of all cell-free DNA. We know that ctDNA can be very helpful in detecting mutations in the metastatic setting, and we can use that information to select therapies in the metastatic setting. In 2019, the first ctDNA-based companion diagnostic was approved for alpelisib, a PI3 kinase inhibitor, in order to select patients who would stand to benefit. And since then, we've seen 3 additional approvals for capivasertib, elacestrant, and inavolisib, and their respective ctDNA companion diagnostics. We are looking at a number of studies in other settings on how to use ctDNA. At ASCO this year in the plenary session, we saw results from the SERENA-6 registration phase 3 trial, which showed that if you were to detect an ESR1 mutation through ctDNA in the metastatic setting before clinical progression and use that information and switch therapies targeting the ESR1 mutation, that the progression-free survival can be better than staying the course. This is really exciting, though not quite ready for practice change yet. I think we have to wait for the overall survival data, but it does signify that there could be a paradigm shift on how we assess clinical progression. We've also seen a number of studies, both at this meeting and previously, showing that we can track ctDNA in the neoadjuvant setting, and that can tell us a lot about the risk of recurrence. If you clear your ctDNA, risk of recurrence is much lower than if you don't clear your ctDNA from the blood, and that you can use ctDNA in conjunction with pathologic complete response or surgical response to further prognosticate patients' long-term risk. And that's super, super exciting. We're also looking at whether we can use ctDNA to detect early metastatic recurrence before we see something on a CAT scan. There are a number of trials really trying to address this. There are some challenges, such as finding ctDNA or using ctDNA assays that are sensitive enough to pick up such low levels of ctDNA, and also needing to test patients earlier before they develop metastatic disease.